Hi, everyone. I'm Dr. Stephanie Eken, Regional Medical Director at Rogers Behavioral Health. I just want to welcome everyone tonight. We're really glad you could join us during OCD Awareness Week and for our virtual screening of Unstuck, an OCD kids movie. If you have not seen this movie before, you are certainly in for a treat. I think I've seen it 10 times and I can't wait to see it again. In just a minute, we'll be starting the movie. It'll be about 20 minutes. And then after the film, I'll be moderating a discussion between some of our guests tonight, who you probably see on screen right now. We have Dr. Sean LeNoue, who is Associate Medical Director for Rogers Regional Division. And then we have Allie Hoden-Bear, the Associate Producer of the film and the mother of a child and her sister who are featured in the film. They are delightful in the film, so you will just really enjoy it. We'll take questions afterwards from the audience. We'll get to as many as we can during the time that we have with you guys this evening. And we look forward to chatting with you after this. So let's get the film going. Welcome back to our panel. I hope you guys enjoyed the film. I have to tell you, I'm always like a little bit emotional during it, so inspired by the work that these kids did and the hope that it can give, I think, to other families as well. And I want to welcome our panelists to discuss more of the film and really hear from important people here. And I'm sure the audience will be excited to hear from you. So welcome, Allie Hoden-Bear, the associate producer of the film, mother of two children, Vanessa and Charlotte, who are super adorable, and Dr. Sean LeNoue, Associate Medical Director for Rogers Regional Division. It's so great to have you both here. Allie, you want to share a little bit with us?
Sure. I first of all, thank you, Dr. Eken, for having me and for Rogers for inviting us. I always used to say when Vanessa was first diagnosed and started exhibiting fears that the whole family got OCD at that time. It wasn't just Vanessa. And that is really why we made this film. We looked for resources that were for children with OCD. We looked for resources for parents. We looked for resources for family members who didn't really understand what we were trying to describe. And we hope that this film just adds to the array of resources that are out there and gives a fresh perspective to people of hope. And that's really what we were trying to accomplish. I hope you felt that today.
I know. I mean, we got to chat a little bit before we actually saw the movie, and I think it's important for families. I think it's important as a clinician for us to have this as a tool and to be able to share with families and to share with other kids. I mean, when we show this to our kids in treatment too, they're like, oh my gosh, there's other kids that have OCD and it's like kind of like mine or maybe kind of not like mine, and it's like they don't get to have support groups in the same way that a lot of other kids do. So I'm grateful that you guys did this because it had to be both hopeful and difficult for your family throughout the process. So
thank you.
We'd like to hear more about that a little bit too. Dr. Sean LeNoue, Associate Medical Director in our regional division at Rogers, share some thoughts with us for tonight as well.
Yeah, first of all, thank you, Dr. Eken, for inviting me here, as well as thank you, Ms. Hoden-Bear, on your work on this film. It's just fantastic. I agree with Dr. Eken. This is a really important topic, and this affects a lot of people, more people than sometimes we realize. So we're talking about, 3.5 million Americans, give or take, struggling with OCD, with at least 500,000 of those being children or adolescents. So this is a big deal, and we know that this is a chronic illness, right? And that if left untreated as well, that the impacts, frankly, at times we see are devastating, but they don't have to be. It's certainly the message that we want to send. There's definitely a lot of stigma out there about OCD and a fair amount of misconceptions as well. But the good news really is that OCD is treatable, and we've got really, really great options for treatment that we know are safe, effective, evidence-based, and most of all, they work. And why that's so important is because, one of the many things that drives us in this work too is just helping individuals, families to get back to living, to pursue their passions, their interests, and leading fulfilling lives. So yeah, thank you again for having me here, and I look forward to our discussion.
Yeah, I think that's so important, Dr. LeNoue. I mean, just what you were saying, like people getting back to their lives. You hear about like OCD taking over the family, and also just like hearing Sarah and some of the others in the movie talking about like these are the things that I was able to do when OCD wasn't in control. Everything from like routine stuff around like I have chores in my family that I want to be a part of to feel part of the family, but also like I want to be able to read a book, play a piano, do those things without OCD being in control of it. So yeah, it's so important to think about what can they get back to. Well, Allie, I think we'd all be very interested to hear a little bit of behind the scenes information from you, not only as a producer of the film, and again, I got to hear a little bit of this beforehand because I was like, how did you put all this together? There's so much amazing content in here. These kids are incredible. Like behind the scenes for your family, you have a child struggling with OCD. She's telling her story. You guys are what, 6 years out now from the movie? Is it that far?
Yeah.
And yeah, what's it like for your family to have participated in this film then, now? Tell us a little bit about that.
I think it's been really a journey. I think that Vanessa was somebody who, and in the early stages, wasn't comfortable talking about this with her friends. She was somebody who talked to any adult who wanted to listen and be vocal, and it helped us get her diagnosed early on. But with her friends, she was worried about the stigma of things. She was worried about saying yes to a sleepover and having to come back home because something triggered her, or how her friends would react to what she felt were different things she did than other people because of her compulsions. And so she really, she got to a place in her therapy where she was empowered. And I think that's what we wanted to show in this film with all of the kids, which is that it's in their own voice. They are taking power over OCD to say, I have a toolkit, I have skills that I can conquer my challenges, and I know how to do it. And even if they come my way, I'm going to have support systems and practice in place in order to fight. And I feel like having it in the voice of kids was a very conscious decision. We really did not want to sensationalize the issue. There's so many things we could have shown that we chose to not show. And the reason why is because we feel like it's the issue that matters. It's not about how it manifests itself in an individual. And each person's experience is different. And the reality is that, when kids say things to other kids, it means more than when it comes from an adult. And so hearing the medical language and the explanation of all these complicated things and the voices of the kids who experienced it became really part of our mission. And I also want to say that we really thought this was going to be a film for kids. And then after we started testing certain things and creating the film, the amount of adults who have reached out to us to say, I finally have something to share with my relatives to explain to them what I've been going through for decades. I mean, it's really emboldened people to feel like they have words to explain. And if they won't listen to me, maybe they'll listen to somebody else and see somebody else's story for what it was. So I'm thrilled. We're all thrilled that it has really hit the mark in being able to help people of all ages support their therapy and support their conversations with people.
I really love that piece that you say about the adults, because actually when we look at the data too, it shows us that OCD presents in childhood so very often, but maybe not recognized, and maybe kind of, goes down and then comes back in adulthood. And it probably gives them a way to like look at things, even looking back into their childhood, of maybe why they did certain things. So I really love that perspective. I do want to ask you another question, because I have to tell you, when I saw this movie, the thing that you guys did that I thought was really special, I'm sure from parents' point of view, but also from a clinician's point of view, was you included Charlotte and Holden's sister to talk about the sibling side. And I just think about siblings so much when it comes to OCD. And I'd just love to hear a little bit about Charlotte and her journey and like what it was like for her to participate in this as well.
Charlotte's a little bit of a pistol, and she will tell you that our plan was not to actually film her, and she insisted on it. And what she said was so priceless, so meaningful that we realized that this was an angle that we needed to continue with. She always felt that it was they're 2 years apart. She always felt that it was the first secret Vanessa ever kept from her. She felt very isolated. She felt very alone when we were dealing in the moment with crisis and challenge. And so she demanded to be at the table. She went to therapy to ask questions. She learned about the brain. She was very young, but she wanted to be integrated in. And I think that really resonates with people all over because we didn't include adults, there's no other way to show the impact on the family. And the reality is that there is great impact on the family in most cases. If you're lucky enough to have people share their experience with you and to voice it, then it affects you. And you cry with them, and you hurt with them, and you do it all again the next day when you need to. So, having Charlotte and the other their experiences, I think, was a really pivotal piece of our process.
Yeah, I agree. Because seeing it from a younger siblings and an older siblings viewpoint, I mean, when Charlotte talked about, like, I didn't even know, like, OCD was a thing, and, like, it was, like, this big secret. I just thought it was, I really like to share that with siblings of kids that we treat with OCD too, and they're like, oh my gosh, yeah, it just opens up a way for them to talk about it too. So I'm really appreciative. Well, Dr. LeNoue, we want you to jump in here too, and we'd love to hear a little bit from you, from that psychiatry standpoint of thinking about OCD and how it can present, right? It doesn't look usually the same in like a 6-year-old as it necessarily does in a 16-year-old. And we know OCD can present very uniquely in any individual, but talk to us just like from a developmental standpoint about OCD and maybe how things might shift or present differently in different age kids.
Absolutely. And certainly, you've done this work for a long time as well, Dr. Eken. And I think the thing that can be so mysterious about this as well is that typically OCD can come on kind of slowly. And there are certainly variations, but it typically builds over time. And then when we think about that component along with an individual's normal development and age and kind of the way that brains are hardwired and how they develop over time, right? We take those things into consideration. And most of all, what we really try to do is to really sit down and really try to get to know an individual, understand their perspective, get to know them as a person, as a human being, understand the family's perspective, because I'll tell you, in doing this work, it is not always clear cut. And I think that is something too that I've learned over the years is that OCD keeps you on your toes. I think everyone involved, and it can shift and change. So, for developmentally, when we think about earlier on in childhood, it can really present in, with like fear of like harm, or fear of like getting sick or dying. And certainly that's not exclusive by any means to childhood, but it certainly can really come on there. And, as things progress over time, you can see kind of worrying about bad things happening, also then kind of things needing to be just right, especially when you start to move into childhood, adolescence, and there's a lot of kind of focus on like the rules and, following the rules and doing things just right. And then, and again, none of these issues are particular or only just at one stage of life, but certainly we can see that. And, really it can progress over time too to contamination fears or worries, and also fearing, hurting others, not wanting to cause harm, but fear of accidentally causing harm in some way to others. Also, intrusive thoughts that could be sexual in nature as well. And so we really see that these issues can manifest in a variety of ways. And taking a step back really quick too, thinking about like, what is OCD in a lot of ways. And so while we know that there's a lot of variance, things come back to obsessions and compulsions. So this is obsessive compulsive disorder. And really what we know is that obsessions are those intrusive, unwanted thoughts or images in one's mind or urges. And they can frequently come up time and time again, even multiple times over the course of a day or over the course of a minute, right, or hours. And they can just suck up the mental bandwidth of an individual, right? And again, they can come in those forms of worried about, harm or death or bad things or contamination. And then the compulsions are the rituals or behaviors that we see that individuals feel, oftentimes compelled that they must do them in order to alleviate the distress associated with the obsessions and the associated anxiety. And so it makes sense, right? They're sort of, adaptive, maladaptive, if you will, but kind of a way to alleviate that stress and pressure that comes along with those upsetting feelings or thoughts. And, what compulsions can look like would be, checking to an excessive degree, whether it's a door is locked or did I turn off the oven or the stove, or, washing over and over for fear of contamination or germs to make sure that, one won't be ill, or that for fear of contaminating others, right, getting other people sick. Also, the need or the feeling of things being just right, that I do things in a particular order or in a satisfactory way, any task that feels just right, so that I know, okay, things are okay, things are in a good place. Ordering, arranging, the list really goes on and on. And we also can see, with related disorders to OCD, even like skin picking, hair pulling. So as you can see, these issues can come up and manifest in a variety of different ways. And, I think what's just so important is there can oftentimes be like the stigma that we talked about, but also shame that's associated, or guilt, or the feeling of, why can't I just get over this? Or, why don't other people have these same feelings or thoughts that I do? And I think that it's so important to recognize that, individuals aren't alone, and that, this isn't just happening to one person or 1,000 people like we mentioned. I mean, we're talking about millions of people here. And again, that there's a lot that we can do to help. And it's certainly the message that we want to send, because oftentimes we will meet individuals and families and they feel exhausted. They feel like they don't have options left. They don't know what to do, and so people will come to us really just hungry, thirsty for knowledge, for guidance, for things to do and not do in order to help, treat OCD. So, yeah.
And I think, that you've hit two really important points. And I want to bridge us over to some misconceptions too, but I do want to just say, I think it's great that that definition of obsession and compulsion, we start there a lot because there are a lot of misconceptions about obsessions and compulsions. Obsessions is used differently outside of the clinical world, right? So people will say they're obsessed with something, and that often elicits like a good feeling, like, oh, I'm obsessed with with a TV show. Like I always talk right now, I'm obsessed with Ted Lasso, right? Like, but that brings a very good feeling to me. And so, that's not what we mean by obsessions. These really cause people to feel, anxious or distressed or something's off. And then the other, piece I think is just like the treatment, which you were starting to touch on, and it's really getting the evidence-based treatment, which is we know is exposures, which the kids were talking about in the movie, the challenges to do the things. And so exposure response prevention treatment. So talk therapy does not work for OCD. Other forms of therapy can be helpful for other things in life, but we know that there are very specific things that we need from an OCD standpoint. Certainly there are other forms of therapy that might be helpful for the family during their own journey with this, but for the person with OCD, exposures have to be part of the treatment plan in order to help them move forward. I do want to talk a little bit about a couple of things. One is I want to make sure we've had some questions from the audience about kids who may be on the autism spectrum and have OCD or have some type of communication disorder, developmental disability perhaps, and have OCD, and how do treatments work with them. So I want to make sure we address that. And I also want to make sure we hit some of the misconceptions around OCD. I think the kids started to hit some in the movie, but we hear this all the time, right? As a family member, I'm sure you have heard it, and we'd love to hear from your perspective, Allie. So maybe we can start there, and then and also maybe you can talk a little bit of just how you guys supported Vanessa through her treatment as well. I know we have some people asking that, how do I support my loved one through this?
Sure. Absolutely. My Wi-Fi is a little unstable, so I hope you can hear me. Give me a thumbs up if you can hear me. Okay. Fantastic. So, look, I think stigma starts immediately from a young person being diagnosed. To believe that there's a bully in your head, to believe that there is something that is confusing to you that you don't understand. I think at least for Vanessa, there was a stigma right away, and she tried really hard to fight against it. And so it took some time to understand that and to explore that. And I think that when you bring kids together, Vanessa used to always say, show me another girl my age who has OCD and I'll believe you. And until then, all bets are off. And it put us at a standstill for quite some time. So really, reading the books, looking at the films that are available, asking, for support groups in the community, whether they're online or in person. All these things are really critical so that your kids or others understand that they are not alone. And I think that's a message you're hearing a lot tonight. For us, there was a lot of support from the family that looked like talking to therapists, again, bringing Charlotte into the room to understand the condition. When we did exposures, we tried to make them fun. They were often a family activity. We talked about things very openly. We talked to others about it very openly, and we made it a point to ask people to read books. We asked people to look at other resources and to really avail themselves of asking Vanessa questions, so it wasn't something that couldn't be talked about. And I think that's really important in the process. And I think that teachers were also a really important resource for us. We were a family who chose to talk to the teachers about it. Some do and some don't. And Vanessa used to write a note to her teacher on the first day of school every year that would say, hi, I'm Vanessa. I have obsessive compulsive disorder. This is what, and I need you to be part of my team. I need you to let my parents know or talk to me when you see me doing something. I need you to know when I need to leave the room because I need a second to cope with something. And that's really how she approached things. She created a team of support. I would like to think we helped her with that. And that's how we got through things together. And that's how we continue to get through things together, is by being there for one another in any way.
Yeah, I think all those, I really love the idea too that you made the subject not taboo within your own family and your community that surrounded her. I think that's really important for them to feel also that there's not stigma within before they can even consider that there's not stigma outside of the family.
Right.
So, Dr. LeNoue, can I pose some questions to you? We could probably go on about misconceptions about OCD forever, so I'm gonna bridge us a little bit. I mean, we know people say they have OCD all the time, right? It's like something I talk about all the time with others, and being careful with their language. If you're really neat and stuff, like people say, oh, I have OCD, or if you're a perfectionist about something, I have OCD. I always sort of a little bit tongue-in-cheek, I say to people, I just ate a donut, my blood sugar is pretty high. I don't run around saying I'm so diabetic. We don't say these things. So we shouldn't say we have OCD, right? We shouldn't buy the t-shirt from Target, the sweater that says OCD, obsessive compulsive disorder. It's making light of, right? So those are things that we encounter frequently, unfortunately. But I do want to bridge us over to a couple of questions that we've had. One is, oh, and it looks like we might have lost Allie. Oh, for just a second we lost Allie, but she's back. We're getting quite a few questions around just the autism spectrum treatment in the context of someone with OCD and autism spectrum. Can it look the same? Does it change up at all? I know you and we could do probably a whole talk on this. We have some real experts in this too in our system, but talk to us about how that may or may not shift treatment. And then I'll take a medication question maybe after that.
Absolutely. And I'll just preface by saying to Dr. Eken that certainly if you have any other thoughts to jump in there.
Yeah, I'll jump into the conversation.
Okay, all right.
I won't be able to help myself.
So
I've been doing this for a while.
absolutely, we want to think about really understanding diagnosis, first of all, and making sure that we understand symptoms and really the origin, the etiology of where they're coming from. And it is not uncommon to have co-occurring OCD and autism spectrum disorder. Frankly, we see it a fair amount. But so then our approach is going to be a bit different. So what are we going to do that is a lot of the same? Well, depending on the symptoms, we're definitely going to want to get in there and work on building a hierarchy that they talked about and thinking about really trying to work on the exposure of whatever those fears may be and thinking about those obsessions and compulsions. Now, where this gets complicated is that there is an overlay, right, of OCD and autism that at times looks, sounds, and, is very much the same. And so I think that really, in doing this work, we really want to try as much as we can to get to the core of where is this fixation, focus, obsession, sometimes very much in the clinical sense, obviously, where is that coming from? Because that will guide us in different ways. We want to think about someone's cognitive functioning, processing level. We want to think about how an individual, regardless of OCD, autism or not, but especially there, how they interact and perceive the world around them. We want to think about sensory input or sensitivities. We want to think about an individual's ability to communicate, right? Are there preferred means or are there possible deficits, frankly, where, we really want to tap into strengths? And so what I would say is that there's not going to be, kind of a one-size-fits-all approach, but very much so meeting the needs of the individual. I could go on, but that's sort of in a nutshell.
Yeah, it could be really, we could spend a lot of time. I think the one, the overall arching thing I would say from what you said in our experience, right, is that you can do exposure and response prevention with children with ASD and with communication, disorders. You're going to have to shift how you present that potentially and how maybe you're doing what we call behavioral contingencies around that. So rewards and those kind of things. I will say, exposure and response prevention treatment is part of cognitive behavioral therapy. And I always say we're doing little c, big B, T when it comes to ERP. So it's behavior that we're going after. So we're not doing also with any child in particular, a lot of the cognitive therapy piece per se, because a lot of it is focused on exposure. We're not going to, doing a lot of processing of feelings, those kind of things necessarily. We're really going to try to help go after the anxiety by presenting them with these challenges with exposure. We've got a couple of interesting questions, and I can't help myself based on my background because I have worked a lot over the years with OCD and kids with eating disorders. And so we got a few questions about, can we speak to OCD? Does it exist with eating disorders? And we absolutely know that they can run together, and we see it quite frequently. And in fact, if you were in our clinic at any one time, you would see people with both diagnoses, kids, fairly often. We commonly see something called ARFID, which is avoidant restrictive food intake disorder with kids with OCD. So they may be what we would call a lot of you might think you have a picky eater, but this is extreme pickiness. It's not the typical 3-year-old, I don't want to eat the vegetable situation. It is maybe mom and dad can only get 4 items in them, and now they've lost their protein source and there's weight loss, and we really have to utilize a food to kind of keep weight on them. It's a really common eating disorder to see with kids with OCD. Sometimes, in fact, their OCD overlays on it because of maybe contamination concerns or other ones that start to overlay on why they're being restrictive in their eating. So we've seen kids lose quite a bit of weight from also emetophobia, which is the fear of vomiting, where they begin to become very fearful of certain foods and will not eat them and can lose weight. But we also see it with a very classic eating disorder, right, as well, with anorexia and bulimia. So they can absolutely run together. And I do want to just present that there is hope for treatment in eating disorders as well. So there is good treatment that can be done for both. So thank you for that question. That's not a super common question we get. And then we did get a question, and we just have 5 minutes left. I can't believe how quickly the time is flying. I think I could talk to the two of you guys like for the next hour happily. But I know people have things to get to tonight and probably maybe want to tuck their kiddos in bed and those kind of things. But there are some questions about medication. Dr. LeNoue, I know you can add into this as well, but certainly we know the medications are sometimes part of treatment for OCD. There are many kids who can be treated without medication. And even though we are child psychiatrists, if a kid can be treated without medication, we're all for that. But certainly the foundation medication that most people are going to know is what we would call the first line treatment if we're going to use medication is selective serotonin reuptake inhibitors, which are more commonly known as antidepressants, right? The things that people know as like sertraline, which is also known as Zoloft, or fluoxetine, which is also known as Prozac, those kind of things. So, sometimes kids, their OCD is so significant that sometimes they can't engage in exposure because it's hard to even start with exposure. So sometimes that can be an appropriate time to start medication. But unfortunately, medications can take several weeks to work and have effectiveness. So we'd love to get therapy and medication going at the right time or at the same time so that we can have the benefits of both. Certainly, we want them doing both because ERP truly gives people skills for the rest of their life. We love to think that, OCD is cured, but for many people it is not. And so then they have that skill set that they can use if they have a resurgence later in life. And I love how the kids talked about it. Like the one was like, it's like a little flea buzzing around me. Yeah, so that's not impacting your life. Now it might become a little bit bigger. And so now he has the skills to be able to deal with it so it doesn't become so big. We've got a ton of questions coming in. I know we're not going to be able to get to all of them because we have 3 minutes left. So I'm going to ask probably kind of a tough one to you, Allie, right at the end as we're wrapping up. I'm actually wondering if Allie can hear us because actually it looks frozen on our side. So maybe I won't. Oh no, Allie, maybe can you speak? Let's see if we can hear you. It looked like you came alive on your screen. Oh, I don't know. We're kind of, I think she's going. Yeah, she's really going in and out, unfortunately.
Can you hear me? Oh, no.
Yeah, I can hear you now.
Can you hear me now?
Yep. So can you speak at all about like, I don't know if Vanessa experienced like not having motivation, but you probably talk to families, like if the child's not feeling motivated to address OCD, any recommendations as a parent? And I feel like we lost you again. I'm going to throw this out there. If Allie can, if we can hear her, that's great. I will say there are some protocols out there now, and Dr. LeNoue pop in as well, in which parents can begin to reduce what we call accommodation, which is ways that, that you're accommodating OCD. People are doing it not to cause harm, but it ends up increasing OCD symptoms often because unfortunately they're not fighting their OCD then. So by reducing some of those accommodations, you can, you can help reduce symptoms. And I just got a little message that said we can go to 8:10 if we need to. So we've got a few more minutes so we don't have to feel so super rushed because we do have quite a few questions. And it looks like Allie's back on.
Can you hear me now?
Yes. So I don't know if you could hear my question about if you talk to families or as a parent, like when your child maybe doesn't feel like they want to work on their OCD, any advice to the families out there?
I do actually. I think we had a really good strategy for this in our family, which is if you don't feel like doing that, what's the thing you think you can do? And the goal was always for Vanessa to leave each experience conquering something, even if it was something we'd seen her do before. It didn't really matter. It was about giving her strength and courage so that she doesn't say the next day, I couldn't do it. So if we had to go back in our hierarchy to a lower number, if we had to pull out an old exposure that really wasn't an issue anymore and say, show us you do that, it was just always about pushing her to accomplish something that she could leave the experience feeling positive about. And I think that really worked very well for us over time.
I love that. And I am curious, so we've gotten some questions too, and I'm curious as the, one of the producers of the film, if you've gotten this, and then we can talk about it from clinically, just things that we hear. So when kids watch this movie, have you had family members talk to you that they worry that their child might actually take on some of the OCD symptoms of the kids in the film? And talk to us about what you say.
Yeah, it's an interesting concept, right? I mean, I can imagine my thinking the exact same thing at some point. Vanessa actually went through a group exposure program early in her diagnosis in Manhattan. And it was one of the first questions we asked the doctor, which is, how does this work? And she assured us that this was not the issue. In fact, it actually leveled the playing field in a way where somebody else could see the humor or the strangeness, the awkwardness of certain exposures and say, why are you afraid of that? And then somebody else could say that to them about something else, so that they each could understand that even though they have these thoughts, others don't feel this way. And that it is really something to work on because it seems a little bit off, or it seems a little bit, like OCD is lying to you in some way. And I think they helped each other through the exposures that they had, actually. So actually, other people's concerns and see how field. I think one things I remember them doing that was really interesting to me is they played two truths and a lie about their OCD. And it was almost impossible to actually guess which one was the truth and which one was the lie. And it's simply because things are pretty off, right? And it's a stabilizer in some ways and really helps people. I think it takes away the stigma in some ways. So that's what I would say to people, which is, I haven't seen it happen. I'm not a doctor. Talk to your doctor about it or your therapist, but
yeah,
it didn't work. It didn't happen to us.
I agree. And if I can add really quick, I would just say too, like that is, a lot of the work we do is clearly like very individually tailored, individualized, but there is a group component. And I don't know your thoughts, Dr. Eken, but I totally agree with Allie that there is like a magic, something magical that happens when you see these individuals come together for their peers and they're like rallying behind one another and cheering one another on because they're all doing really difficult things and they're outside of their comfort zones and they just keep pushing each other in a really great way to keep going. It's awesome to see.
Mm-hmm.
Yeah.
Yeah, I mean, I think I totally agree with both of you that they're probably going to take hope away from this movie rather than a new obsession. And I mean, I have seen a couple kids, what I would say, try on an obsession of somebody that they're in treatment with, but it just doesn't last because it has no meaning for their OCD, right? They're like, oh, I mean, washing my hands doesn't actually reduce any kind of like anxiety for me.
Mm-hmm.
So it doesn't stick. But I've seen a couple of kids try, but it just seems to fade because it has no meaning for them. I love that, the truth and the lie piece about the OCD. We're going to have to take that and utilize that. We do have some clinicians who are watching this as well, which is great, not just family members. And so we've had some questions about like some good resources that we would recommend specifically for those working with OCD. I know, Dr. LeNoue, you and I could probably recommend a few, but any that you want to specifically recommend? And Allie, if you have any too, we'd love to hear your thoughts. I mean, UNSTUCK I would use.
Thank you.
Yeah, I would totally say UNSTUCK, and certainly the IOCDF website is fantastic and such a great resource. And there are a number of great books out there too, written for patients and families that really talk about being able to push back some, right, and regain that independence and to break free. I mean, frankly, sometimes people are almost, held hostage, frankly, by the severity of symptoms. Talking back to OCD is a book that comes to mind.
Yeah.
Your thoughts too, Allie? Yeah?
I wish my husband was here to answer that question because he's always looking at new resources and whatnot. I would refer to the ones that you already said, actually.
Yeah, there's some great stuff on there. Talking back to OCD is a real classic by John March and, one of the original ones sort of written on exposure for kids. I would also say if you're a clinician who's going to routinely treat kids who have OCD or adults, this we're not sponsored by IOCDF, but we love them a lot and we work with them a lot. And we actually help train in their Behavioral Therapy Training Institute. And so they actually have like a 3-day institute that you can participate in with really some of the greatest people on the face of the planet when it comes to treating OCD that you get to interact with and hear lectures from. So I would highly recommend if you're going to routinely treat people to go to the BTTI and get that training. But lots of great books that are listed on IOCDF as well. There's so many great authors that I hate to just name 2 or 3 because there's some really, really great resources out there.
I will say on the UNSTUCK page, there is a list of resources, and there's books. There's books for kids of all different ages on there. Vanessa was diagnosed using a book where she related to a character. It was a very powerful experience for her, and I think it really helps at different stages what you're experiencing. If you can relate to somebody else, it helps a lot.
Yeah. And just a plug for some of the work that we have done during the pandemic at Rogers. So we offered free webinars for clinicians around OCD and even shifting your treatment a bit in the midst of the pandemic that I know that you can still access through our website as well. So there's lots of great material out there. I do want to now we really do just have 3 minutes. I do want to say too, in the pandemic, there are some specific things that people have presented with, and I know that's something that we just wanted to say there's information out there about as well through IOCDF, through some of our webinars that are out there. But people are presenting with fear of, even hearing Vanessa say she was scared of getting people sick. We have heard that so much through the pandemic with COVID. With that fear coming up, with the fear of them getting sick, with the fear of giving the illness to a grandparent, to an aunt or an uncle or whatever family member. So we have seen quite a spike in that. Not surprising, lots of contamination. I always say OCD is opportunistic. It takes advantage of things that are important to us. So kids at different developmental stages, the people that are important to them, the activities that are important to them, it is cruel that way. But the hope is that, they can get those things back. So any parting words in our last couple of minutes, Allie or Dr. LeNoue? I've loved having you here, and I'm sure everybody's enjoyed hearing from you.
You want to go first?
Dr. LeNoue?
Please. Yeah, go ahead.
Go ahead, Allie.
Oh, okay. So I just say that I think the OCD community is really strong and really big, and really find you and take advantage of it, and know that whether it's a Yahoo group of a parent or a kid or somebody who is treating OCD, it's valuable and can help you.
Yeah, I totally agree, and I would just say to individuals or families that are struggling, you are not alone, right? There is hope and a lot of great things that we can do to help treat, to help people regain their lives and their functioning, because oftentimes, all too often, sadly, people can feel really alone and like they don't have a lot of options left. But please know that there are many options. So keep fighting. And yeah, I'm really glad that we were able to talk about these really important things.
So thank you, Allie and Dr. LeNoue, for joining us tonight. We truly are out of time now. They gave us a few extra minutes, and we are appreciative of that. We are appreciative of everyone's time who joined us tonight. It is OCD Awareness Week, so hopefully there's something going on around you that you continue to be involved in. If we did not get to your question, I tried to hit many of them, but you guys had some really great questions. Please direct message Rogers on Facebook your questions, and we will work to get answers for you for your questions. And then just for more information on OCD treatment that Rogers provides, you can go to our website, as well as for some of the videos and whatnot, and that's at rogersbh.org. So I always like to say ORGERS. bh.org/resources is also another place with the videos and blogs where we have a lot of information. So we have so enjoyed Unstuck, and you can also view more information about Unstuck at ocdkidsmovie.com. You should go to the website and see more and tell more people about it. We are so thrilled we got to look at the movie again tonight. So everyone have a great night and have a great week.
Take care, everyone.